Hi, my name's
All right.
Olivia.
Nice to meet you.
Nice to meet you as well. Could you tell me a bit
Yeah.
about the patient and their family today?
Tambayi su ina take. Yeah, this is Jibril Aliyu. Sorry about that. This is Jibril Aliyu. He's 8-year-old student,
Okay.
and his father is a trader that earns less than $100 per month. And he presented with fever, headache, and abdominal pain, 3 days duration.
Okay, could you tell me a bit about the fever? Was it more of an ongoing thing or was it kind of a come and go type of fever?
The fever is on and off, goes and comes.
Okay. Do you happen to know if the patient lives near any still bodies of water or if they walk to school?
Yeah, they live in an overcrowded area, and this sewage system is not effective. It's not good. Okay, with a poor sanitary condition.
Okay. Would you mind holding the patient's hand next to yours?
All right.
Yeah, that's great. Thank you. And would you mind pulling down the skin beneath their eyes a little bit?
All right. I'll do that for you. Can you see?
I can. Does the patient have a cough of any kind?
He has cough and runny nose.
Have you run a rapid diagnostic test?
Yeah, rapid diagnostic comes test done, and it's positive for malaria.
And how many pluses did that yield?
2 pluses.
Okay, so he is presenting with malaria, but it doesn't seem to be a complicated case. So for that, I would
Yeah.
recommend just ACT oral tablets.
Yeah.
As for the anemia, did you run a full blood count for that?
Yeah, we did a full blood count. And what will you want us to check particularly?
Could you check the hemoglobin count?
Yeah, we did a hemoglobin count, and it was 9 gram per DL.
Okay, so that doesn't seem to be too severe either. So for that, I would
Yeah,
recommend just
yeah.
oral iron supplements.
Perfect.
Okay, as for the respiratory tract infection, could you collect a sputum sample and test that for bacteria?
Yes, the culture sample came out, and it was positive for bacteria.
Okay, so that seems to be a bacterial acute infection. Could you
Yeah.
give the patient antibiotics for that? And then
All right.
for supportive care, maybe some cough syrup and some antihistamines.
All right. Okay, is there anything you want the patient to take home with us in terms of advice?
For the malaria, I would just recommend wearing longer sleeves and pants outside.
All right.
Preventative, like maybe some repellent ointment for the mosquitoes, or just nets to keep them out.
All right.
As for the nutritional anemia, I'd recommend a better diet with more iron-rich foods like meat, liver, green vegetables, raw vegetables.
All right.
For the acute respiratory tract infection, immunizations are always a great route to go. Treating for things like mumps and measles and the flu, that's a really good way to prevent it.
Perfect.
Yeah.
Oh, lovely.
Thank
Olivia.
you.
All right, that was perfect. You did absolutely well. Okay.
Thank you.
And you took your time asking about the fever, whether it was on and off. All right. And you wanted to know also whether there are other symptoms associated with the fever, like cough, catarrh, sore throat, runny nose, or sore throat. Okay. And so that was also awesome. Now, you also took your time to check. You asked me to check if the patient has paleness, it has anemia, by checking, say, the palm, all right, and also to check the eyelids, the conjunctiva.
Yeah.
All right, that was also great. And of course, you asked for rapid diagnostic tests, which came out positive. You made the diagnosis of malaria, and you asked for the culture of the sputum. It came out positive for bacteria. All right, so you made a diagnosis. You also asked for the hemoglobin level, which is perfect. You did well. You knew it was mild anemia. All he required was just iron supplements. Okay.
Yeah.
Oral iron supplements, and will be fine. And you gave the right treatment also, and the right antibiotics. So also antibiotics for the ARI. Okay, and antihistamines also. and cough syrup probably. And also you gave him the right advice for him to go home, stay in sleep in insecticide treated nets. All right.
Yep.
And also to stay in a hygienic region so as to prevent spread of infection. All right, that's perfect. And so the patient did well. All right,
Yeah.
so that was awesome. Do have a great day ahead.
You too. Thank you.
All right, bye bye.
Bye.